Hello and welcome to this week's Oregon Minute. Today we are interviewing Oregon Area Fire EMS Chief Glen Linzmeier. Hi Glen.
Hi Emily.
How are you doing?
I'm doing good.
So how long have you been Fire Chief for the village now?
You know, it's interesting that you ask because last Sunday, which I think was the 16th of August, if I recall right, was it'll be 4 years that I'll be in Oregon already. 4 years ago, the Fire and EMS District over there went and hired me as a consultant, brought me in, and then December of that year they took the interim title away, and so it's literally 4 years I've been in the Oregon area, and it just seems like yesterday.
What is one thing, or how do you feel you've evolved over the last 4 years as chief?
How do I feel? I think we came a long way with the Fire and EMS District. Anytime you come into an organization, you don't know how you're going to be recepted. And being the district, the makeup of the district, and again, that district is a large district, 44, 46 square miles, 3 municipalities being townships, the town of Rutland, the town of Dunn, town of Oregon, and then, of course, the village of Oregon. A lot of different, bosses, a lot of different people to answer to, a lot of people to protect, a lot of different interests, a lot of different thoughts, a lot of different employees. When you come in as that outsider, it's a learning curve and trying to adapt and try to work with a lot of different walks of life, a lot of different people, a lot of different age groups, from young to old to you name it. I mean, you just have to be able to adapt. So, as anybody coming in new, you always worry about, are you going to be accepted? What are they going to think? You see these things, you want to make changes. Our board over there, the joint board, and also the commission, very open to suggestions and possibilities about changing the direction of the department, making things happen, upgrading equipment, looking at the demands, the growth of the fire district, not just the village, but the whole fire district, all that kind of stuff. So just doing a good rapport over those last 4 years and that kind of stuff, trying to give the decision makers the best tools possible, the resources to make the decisions for the future better outcome of the Fire and EMS District. And I think we've done a pretty good job in managing the cost and also managing the operation and still growing the operation all at the same time.
So when you mention, managing costs, growing the operation, I would imagine the COVID-19 pandemic has posed a unique challenge for the district. So I'm curious about what it's like leading the district during the COVID-19 pandemic.
I guess I go back to my tenure of being in the Fire and EMS arena. Keep in mind, I got in this arena back in 1984. Again, volunteer fire, that kind of stuff, and just kind of worked, throughout. I've seen a lot of different things. You think about Ebola breakouts, you think about anthrax, you think about hazardous material situations, all that kind of stuff. I would never have thought in my 35 years plus doing this that I would ever see a virus or something like this cripple the country, the world, to the magnitude that it has, and as many people being locked down. I think it's just unheard of. You just would never think that you couldn't travel wherever, because this is a free country, a free nation, and you can do whatever you need to do, much less go wherever you need to go. And then just in general, mask. I mean, you're sitting in a mask, I'm sitting in a mask. You might have seen this in some other countries around the world. But it's one of those things you never would think that would be in our backyard or neighborhood, and that we would be wearing them this day and age. So when you have that, and then when you're the leader of the organization, when you have both fire and EMS disciplines that people rely on you to respond to emergency calls, not only on the EMS avenue, but also on the fire avenue, And then you hear all these haunting stories from what came out of New York and everything else, where fire companies are down and EMS companies are down and the lack of personnel and all that kind of stuff. And then I have my men and women over here that basically say, you know, what are you giving us for direction, and what should we do, and how can we disinfect, and, you know, protocol changes, and, you know, different stuff that we do out in the ambulance and all this other kind of stuff. All that kind of stuff, you know, our worlds, my world, and a bunch of our worlds changed just like almost overnight or within a couple weeks. And we had to get our best answers between our medical direction teams and our medical docs to give us in a position to keep our organization up and running and be able to respond. You know, I'm not going to, I'll just be open and honest with you and the community. You know, there's a time that there was about 14 or 16 of us that we were watching ourselves really close because we were probably exposed in some areas. Fortunately, the good outcomes came and good medical advice. And, you know, I go back to the early March. You've seen our members of the fire district and EMS crews wearing masks, and everybody kind of looked at us around the area like, why are we doing this? But that was on direction from our medical direction team, because we were there and this was the only way we could protect certain things and protect our interest inside the building and limit the folks that come in and protect our employees that come in each and every day. So as time went on and more people had to start wearing masks, my employees are like, well, you know, it's kind of catching up with the rest of the area, and it actually went over a little bit, and they kind of were, you know, a little bit more receptive of wearing masks as others came on. But again, it's just, you know, it's unheard of. It's things that we never thought we would see. Now we're probably really getting, I don't want to say we're used to it yet, but it's kind of the new norm, and this new norm is not going to be going away anywhere. And it's just the way how we handle EMS calls and fire calls now, the things that we do differently than we did, you know, 6 months ago.
So that, obviously your position, a lot of it entails not only keeping people safe, but teaching people safety as well. There's a big educational aspect. And so, you know, all of your comments about mask wearing and the safety precautions that you and, you know, the rest of the district are taking, what advice do you have for people who maybe subscribe to the idea that, you know, the virus is a hoax, or the pandemic isn't something to be taken seriously, it's just another flu, or, you know, a narrative along those lines? What advice do you have for those people?
I think you have to look around our neighborhoods, our county, our state, and continue to just watch the death count or the amount of people that are infected every day. Again, I go back to the early notifications on some of the first calls back in March for our folks. Take in mind that we've got an ambulance going to a call someplace, we get a radio report that it's a positive COVID patient, and it's like probably the first one that we've been on. Our crews are at a high anxiety. We've been trained, we've talked through it, we've done all the tabletops, we've done all the paperwork. Everyone knows this is the protocol we're going to follow, but then you have that first one, and, you know, so like that first case, you know, even myself, we were out in the field and we were dressing our people out and going that extra 9 yards, putting those N95s on, making sure all that stuff was happening. 911 is telling us it's a positive COVID case. Now your EMTs, your crew have to expose themselves, treat this person, take them to a medical facility. The outcome was good, all that kind of stuff, but you just kind of work with that. And then now you got a rig that we bring back, and we have to decontaminate the rig. And everybody knows it's a positive patient, and everybody's working in it, and you dress to a higher level of, you know, it's just not normal street clothes. Now you wear a Tyvek suit and a respirator, and you're cleaning down, because CDC and the state health department and all the folks that we turn to really don't have good evidence for us but we have to clean this rig. We have to make sure it's safe for you, for the next person that we transport that could be in the back of that ambulance, and we want to make sure our crews are safe. So ongoing research, we had an ongoing research crew that basically always were checking the best ways throughout the country, out the world, what and how to do things as far as deconning the ambulances, the fire trucks, and then all the instruments and all the different stuff that we have, the stuff that we would say would not be disposables and we would reuse, that kind of stuff. So education-wise, I mean, out of our group, 35, 40 folks that we have over at the fire district, keeping that communication open, educational segments, part of our target solutions we'd send out where people can watch video clips and have a good idea what's going on, how to decon stuff. As soon as we heard of, they were using in the eastern part of the state down here in Wisconsin, some chemicals to spray inside of the rigs afterward. We're doing that on a weekly basis now, that we go through and we spray all the trucks just for safety of, basically killing any airborne or anything else that's possibly around. And in the larger picture, this will take care of, the common cold, the flu, different influenzas that we have, all this kind of stuff. But you look back, just the way that we've changed so much and so many things for a lot of people to adapt. And then, then they tell us, we don't want to have any more than 10 people in the fire station. Well, we're used to it. Anybody been around Oregon, you see on Tuesday nights, we'll have, 25, 30 people at the fire station on Tuesday night for training and bring them in and have it in person. Well, we had to adapt to that. So Zoom meetings and, a lot of online stuff and a lot of informal stuff. There's just a lot of different things that one doesn't even realize. But we've had a good group of our command staff and our officers over there that built this out and made it safe and effective for our operation.
So what you're saying is that, to people who maybe don't necessarily believe COVID-19 is real, it sounds like what I'm hearing is you're telling them, look at just how many things the department or the district has had to do to adapt, and, maybe then see that as, okay, yeah, this is something to take serious.
Like I said, I think we did a Facebook a post back in early spring. For those that didn't believe it, it is real. Don't be afraid of it, but respect it. Take it serious, respect others, social distancing, wear a mask where you can, and hygiene. Wash your hands, hand sanitizers, wash your hands, hand sanitizers as much as you possibly can. Going into public facilities with carts and pushing carts. A lot of places are washing them, taking care of them, all that kind of stuff. Respect it, think about it. Watch your young kids. I got grandkids. Take care of your grandkids. Make sure that they do the same thing. Educational process, but just over and over and over and over. And it's not a hoax. I have to kind of laugh to myself sometimes. You hear the thing, well, it's going to be over with after the presidential election. You know what? I think COVID's still going to be here after the presidential election. But it's interesting that some bring that up and play that direction.
Yes, there are a lot of ideas. I know there were some people who believed that, it would go away in the summertime because sunlight killed the virus, or there are some who believe that 5G towers contributed to the pandemic. And it just, what you say speaks to just how much information and misinformation is out there. And so, but what I want to talk about next is, I was wondering if you could give me a snapshot of your, you did say the district continues to grow, and it sounds like even during the pandemic, you just hired someone new. Mm-hmm. Give me a snapshot of both your staffing and revenue situation.
Our staffing and revenue situation? Well, currently, a part of the 2020 budget process, we recognized as part of, going back to when I got hired a few years ago, we started looking at all of our capital budgets. We started looking at all of the equipment we have. We started looking at the build out. We're looking at what really makes Oregon and how it operates. So we basically got a fire and an EMS division. We got 2 divisions, and they both work hand in hand, one with the other. And there's just the need for some more internal management. So last year, during the budget process, we decided that it was the best direction for the district to go and hire a division chief of EMS and start building out our divisions. Right now, all of the divisions fall underneath the fire chief, and that's basically the only admin position I have that's out of our organized labor folks. But we decided to build that out, and we did that. We were going to do that in early 2020, like in January, and start that process. So then we bring the joint board in, and we started to figuring out how we wanted to do that, all that kind of stuff. Started the building out the job description, and then of course post the job description and post the hiring position out there, all that kind of stuff. And then COVID came along, and we had the interview set, and then we had to cancel the in-person interviews. And then about 6 weeks later, we started to do some Zoom interviews and all that kind of stuff. Went through the process, got our membership involved, and went through a bunch more Zoom stuff. Anyhow, here nor there, after probably in June, I think it was, we finally made a position offer to Casey Jessberger. Casey comes from Sun Prairie Fire and EMS, used to work for Janesville. You guys already did a little article on him in the paper here a couple weeks ago. So we brought Casey on, and the position of Casey is to continue to build that out and looking at our EMS needs and all that kind of stuff. And currently we're at the IV Tech level, so you got the basic EMT level, and then we of course go up to the IV Tech level where you have, man, I'm forgetting it, IVs, where you can start IVs and that kind of stuff in the field, and certain medications, that kind of stuff, and then of course we go with the paramedic level. One of the larger things in some of the other operations that I have been in the past, we've always been at the paramedic level, and we started to look at that and think about our growth and where we're going to go. With our aging community and the growth of Oregon and the number of calls that we have, all that kind of stuff, the plan is down the road is to go to the paramedic level and upgrade our folks. We've got quite a few paramedics already inside of our organization that work for other services around, and out of our, say, 30-some members or so on the EMS side, probably about 14 of those are paramedic, and we want to bring those skills right here to our community and protect our citizens and grow that out, especially with our aging population and the growth of everything that's going on, and the response of being away from the hospital, say probably 30 minutes or more, all that kind of stuff, just the way treatment is happening, all that kind of stuff. Going back to talk about the dollars and cents about our operation where we currently are now today, as far as run revenue and all that kind of stuff, currently we're holding in about 25 calls currently, probably less this year with COVID than last year. As far as dollars and cents, you're probably looking at, you can think those EMS calls are probably in the, depending, $600, $800 a call, maybe 25,000 or so right now. If you take it on the high side, that you could probably be a little bit less. No racetrack events this year. We didn't do anything at the racetrack. Greg and Angie now opened up just last weekend. We're doing a few things out there, but we didn't have any expense, but we didn't have any revenue also from going out there, and some other things. We didn't have the milkman or the race go through town. So we got some different things. All in all, when we're all said and done, I think we're going to be pretty close to still being in the black or being good where we need to be, that kind of thing. But that is probably only managed with some of our other overtime issues and that kind of stuff by, again, having our paid-on-call members fill in some of the positions from our full-time people when they're on vacation, that kind of stuff to offset that. So you got, a couple $1 million budget, and you take all this stuff, and when you're all said and done. But I think at the end right now, like I told the commission and the towns at the joint meeting here a couple weeks ago, I think we're going to be in pretty good shape, all in all, and we should be, again, shooting right for that, that break-even point for the fire district and all that kind of stuff.
So what kind of feeling does that evoke, knowing, I know there was a lot of financial uncertainty, especially at the beginning of the pandemic, as basically everything, like you had said previously, almost overnight went to a standstill. So how does it, I would imagine that it's a relief for both you and your staff that you are still going to be in the black, as you say.
I don't think, I'll be honest with you, I don't think my staff thinks about being in the black or the red. They've got a job to do, whatever they need to do. They look at me to provide the equipment, provide the training, provide the personal protective equipment that they need. And I think that is my job. And then it's for me to sell that to my bosses in the community, the people that we protect, and say why we need it, being able to do that kind of stuff. I will say that the district and the commission here stood up quite loud and clear, different than a lot of other organizations around the state or the county. When this came down, again, I go back to, I don't know if how many staff I'm gonna have. I don't know at any given time. I have 7 paid people over at that fire district. That is their full-time job. The rest of them are paid on call or paid on premise folks, people that live in our community or come into our community and work for us. And one of my biggest fears were if, again, this was going as bad as what we saw on the national news, what's happening in New York, am I going to have anybody to respond to any incidents? And one of the things I wanted to do was make sure that people understood that our folks cared about it, and we did. And we basically came up with a plan that if any of our folks come down with COVID, that we would be taking care of them for a specific amount of time, and we would be helping them, with some benefits, because in some cases our paid on call and paid on premise folks don't have those benefits, and the district did that. Knock on wood, we've been very successful with our other mitigating efforts to keep that to a minimal, and we've been, again, working through it, all that kind of stuff, but nobody walked away from me and said, hey, I don't necessarily want to not come to a call at 2 o'clock in the morning, or I don't want to work on the ambulance on Saturday at whatever time, 6 a.m., because they see the need and this is what they do and all that kind of stuff. At that same time, there were other mitigating efforts that, again, our research team came up with and said, Fire Chief, we need some ultra lights, some blue lights in here to put in the ambulance, put in different areas and kill the virus. Just another layer of protection besides us spraying some kind of a disinfectant. Took that stuff back to the board, to the commission. The commission said, Fire Chief, you know what you need to protect your people, keep our operation in play. Go ahead, take care of the stuff. And I think as of today, I think in covert efforts that the fire district spent, I think we're about $12,000 where we bought extra. We never had blue lights before in the light systems, but now we run them in the back of the ambulance periodically. We rotate them around. Like I say, we got sprayers and we're spraying different stuff. There's just a lot of different little intricate things that we put in play to protect not only our employees, but the people that we transport to any medical facilities or pick up at one of the retirement centers here in town, that kind of stuff, and haul them in to a medical facility. They want to make sure that we are doing everything we can and then some to keep their loved ones protected. And I can assure you that we are.
And that's what I had meant when I meant like in the black. It's not necessarily, I didn't mean that as a relief, like, oh yay, I get to take home another paycheck. I meant that as, knowing that resources, if needed, will be able to be provided to the staff. And so I like the point you raised too about the, your volunteer staff. You haven't had a fall off of those people. What do you have to say to your staff who still at the end of the day were willing to go out and if there was a COVID-19 patient, put themselves on the front lines like that? What do you have to say to them in regards to that?
Well, you got to lead by example is number one. And what I mean by that is when I know in the early first calls and maybe the first couple of weeks when this was going down, you see the call, you listen to the radio reports, you know it's COVID. I was in here with the crews, deconning that ambulance, working with them side by side, again, going down, making sure the boxes are checked that, hey, we're doing this, this, and this, and you're wearing this level of protection. And oh, by the way, when you're done with that, we stood up our decon room, which is part of the occupational safety and health program of a fire station and EMS operation. Again, the decon room is there. It's there for like hazardous materials and all this other kind of stuff that we may be around. But now we put our people in, we do all this stuff, and then they got a shower, they change their clothes, and it's not brought up into the living quarters. There's a clean cut, a clean division. People understand that and are happy to see that their main boss or leader is with them and working next with them through this, because again, this is a lot of unknowns to both of us. I mean, all of us. And then you got the medical direction team on the phone, and hey, this is what we did. These are the things we did. Is there anything else? And just those assurances. And then when you're all said and done, we all look at each other. We all thank each other for being there and ask questions for emotional support, that we're ready for the next call and we're ready for to talk to the next group at the next shift change, to let them understand our experiences and the things that we went through and what best practices maybe per se, that this worked out better than that and all this, that kind of stuff. And you go on to the next call and you thank them and you make them feel appreciated and you thank them and you thank them and you continue on.
Well, to that end, Glenn, I want to offer my own thank you and just thank you to you and your staff for continuing to put yourselves on the front lines during this pandemic, and just, how you just prioritizing safety over anything else, I think it's admirable. And, just to be able to go into a situation and that's so uncertain and educate yourselves, adapt to it as best you can. I want to commend you and your team.
Well, I thank you, and I can tell you that the men and women that are over at the fire district, each and every one of them will lay their life on the line for risking for another life, and that's what we do, and that's their intention. And scary times and all that kind of stuff, but they will follow through and do what is needed.
And so, wondering, Glenn, I believe that answers all of my questions for today. But is there anything else you would like to discuss?
The only thing that I would add, and again, everything is COVID and COVID, and then some related. But in general, I will have to say very much thank you to a lot of different folks in this community. It is unbelievable the outpouring of support, people that have donated food, money, cards, thoughts, kids, all walks of life. I'm assuming that happens in a lot of communities, but it's really pretty overwhelming in Oregon and very much appreciative. People have, again, bought dinners for crews, catered food in, brought cookies, you name it, just a whole gamut of stuff. People have came in and said, when the federal checks came out for COVID relief, they helped their family out, and they came down and asked me, we want to donate some money to the fire district. We've helped, and I said, you don't have to do this. You don't have to do this. Take care of your family. I found out they had family. Kept some money for the family and donated the rest of the money to the fire district. But Fire Chief, we want to know what you're going to use this for and what can you put this towards. And we put it to some more, the blue lights and that kind of stuff. They wanted to know what it was for. We told them and that kind of stuff. And they want to be, they want to keep their names out of the papers and all that kind of stuff. But they're really thankful for everything. And again, I've told the board, again, just the outpouring and the community support through the pandemic, all that kind of stuff, really very much heartwarming. I mean, our people see it all the time, and again, you don't have to do that stuff for us, but is it appreciated? Yes. But just, really makes you really feel good, I guess, in the jobs that we do and the stuff, that there are a lot of people out there that do care about emergency responders. And I've been in that emergency responding field for a long time, and it's a good feeling, and I hope my young staff will see that and be around and stick with it as long as I have, maybe even longer. But that is what it's all about, helping the community and giving back.
Well, once again, thank you to you and your staff for everything you've done for this community and beyond. And thank you for appearing on the Oregon Minute this week.
You're very welcome, Emily. Thank you.
Thank you for viewing this week's Oregon Minute. Tune in every Thursday at 7 p.m.